Ladies and gentlemen, good afternoon. I'm Rob Recker, President of Chamber Benefits, Inc., and it's my pleasure to welcome you to this afternoon's webinar. My role at the Chamber is to help you save money on your most essential business expenses. And we know that when we can save our members money, they reinvest those savings back into their businesses. I want to thank you for joining us over your lunch hour and for being a valued member of the Chamber. This is the second of our three-part webinar series, and this afternoon we're going to focus on how Cigna's health engagement tools and resources will help you build a healthier workforce and lower your costs. Our speaker for today's webinar is Cato Johnson III, an engagement consultant at Cigna who is responsible for developing strategic wellness health improvement plans, customer engagement initiatives, coordinating open enrollment activities, and educating customers to become better consumers of healthcare. In addition, he leads on-site and virtual presentations to employees to educate and inform them on products and health promotion initiatives, as well as providing ongoing analysis to identify opportunities to improve organizational health outcomes. Cato is a proud graduate of the University of Memphis and Leadership Memphis. Cato, I'll turn the program over to you.
Thank you, Rob. I really appreciate that kind introduction. Let me share my screen. I appreciate that, Rob. Thank you so much for having me and giving me the opportunity to present today. Looking forward to going through some high-level information to better help the employers understand my role and what Cigna does and how we partner with you. Again, hello, everyone. My name is Cato Johnson III, and I have the pleasure to present to you the overview of the engagement resources and capabilities presented by Cigna. I'm excited about this opportunity to help raise awareness from some great programs and resources that we have available. So let's take it away. First, let's look at our vision. Our vision is simple. It's to partner with you and guide your health engagement strategies toward increased engagement, improved outcomes, and a healthy bottom line. So today, as we go through the presentation, we're going to go through how that looks from my point of view and how we can better help you make those type of decisions. As your engagement consultant, I serve as the connector between our products and our services, as well as the population that we service our products with. I engage the population and not only empower the client experience, but the customer experience as well. We encourage you to utilize our team as you begin the process of our medical plan. We have a great team of guided experts. Not only do we focus on benefit education, but we also focus on delivering and driving those products as well. When we look at some of the things and over the stats, over 86% of Cigna healthcare clients feel that a health engagement team member is a valuable resource. 70% of employees enrolled in wellness programs have reported higher job satisfaction than those who are not. So those are high numbers, and those just tell a slight story of some of the things that we do and how we've evolved to service our clients. Health engagement is just not a talking point with Cigna Healthcare. It's built into our design and the way we do business with you and with your team. We understand that healthcare is a big expense. We know this. So we want to make sure your health plan is getting the most of your health plan and you're getting the most of your benefits and getting those in a way that you can understand. That's why we set you up from the very beginning to have the process at the very beginning, to have the confidence to be able to make decisions about your health. We are the only carrier to provide clients of this size with a dedicated engagement team member at no extra cost to you. Our team is very diverse. We come from different backgrounds, but we share that common goal. And that common goal is to drive health engagement and meaningful change for your organization. They just don't provide you with the information and the materials and have you learn them on your own. We help you along the way with your journey to make sure that you're understanding the process one step at a time. So let's look at a little bit how that process looks from beginning to end. We know that the customer onboarding experience is very important. Looking at the benefit education support that we provide, events supported to offer our organizations with the education of the employee benefits. So we really want to start with each client with the open enrollment benefit education so we can answer any questions that they might have, health benefits so they can really understand. We have a suite of demos that provide an overview of the Cigna healthcare wellness programs, including the importance of enrolling into these key programs early and often. That's really the blueprint for success is when we initiate our programs, we want clients and members engaged in our programs early. The earlier that they can get engaged during the open enrollment period, the easier it is for them to navigate those benefits throughout the year. We support and execute the program. We set measurable goals, and specific actions to help you get to where you need to go. We're going to make sure we arm you with all the appropriate resources, campaigns, employee seminars. We build our reports and our recommendations off data and reports to really make sure that we're hitting those touch points. Every client is unique. Every client has different objectives that they're trying to reach. And we want to make sure that we coordinate and really specify each client with their own unique strategy. We provide mid-year check-ins. Clients that commit to the recommended strategy that we provide, we look at the mid-year check-ins, we review the data, and we review. We review where we have progressed towards, and we also look at some things that we might need to take a step back. It's a process to learn this information, and it's a process to build a healthy culture. So those are the things that we continue to do. And as the year progresses, when we get to the end of the year, we look back at our performance reviews, we look back at our data, at a full year plan, and we look at our metrics, the metrics that we have shown at work, and also some of the metrics that we might need to revise as we continue to build the culture of well-being that we're looking to build. So these are just a few things that the engagement consultant plays a role into developing to your company. It's very unique, but these are just the foundational pieces that we recommend to building that culture of well-being and really getting the information slided to the customer when they're needed. The next step in the process, after the open enrollment meeting, after some of the demos that we have shared, is the organizational assessment. This is when we partner and review and evaluate the organization's strength and opportunities as we continue to build our recommended action plan. So we understand that Cigna, we listen. We're very we know how to adapt to change, and we listen to our customers and we listen to our clients. So the best way to listen is to see the opportunities that they already have available so we can enhance those opportunities and also look for opportunities to be able to help fill the gaps of things that they might not know about or might not be doing. And this is when the organizational assessment comes in. We partner with you. We review and evaluate your organization's strength and opportunities. We focus on 5 key areas: our organizational snapshots and foundations, our population health engagement program. We look at the policies, the health-related policies and accommodations that you already have in place. We look at the social determinants of health, which mean we don't look at just of the resources that you have. We help you look at Does your employees have the access to these resources? We look at our Cigna healthcare capabilities and all the programs and resources that we have available and how those tailor-made to fit what your culture is already doing. You will receive specific recommendations after we go through this assessment, and then we begin to tailor-make your program. We revisit this year over year as we begin to go through strategy with building that culture. We go back and to look at this and we make changes. The great thing about the Cigna org assessment is it evolves into the Cigna Healthy Workforce designation. The Cigna Healthy Workforce designation provides an opportunity for the organization to showcase their commitment to creating that healthy culture. So as we go through a year, clients within the second plan year of Cigna, they are considered to be a bronze, silver, or gold designation winner as we build the strategy and we partner with you. That is an extremely proud accomplishment for a company to be able to have the badge of the Cigna Workforce designation, showing the commitment to your employees, showing the commitment to your company that you are making the changes and you are putting your employees first to create that culture of well-being. You have the process and the ability to win a bronze, silver, or gold designation, which is very, very unique for any company to be able to showcase that. You have the access to get additional toolkits and turnkey promotional assets that you will be able to show on your LinkedIn and be able to also post that badge to your company intranet site or anything around the building, monitors, posters to show that commitment of the Cigna Healthy Workforce designation. It is an amazing reward. And those are the things that Cigna partners with you, with the engagement consultant, for you to build those credentials to your company and add those to the different things that you're doing to promote excellence and a culture of well-being within the products and services that we promote. So these are just a few of the things that we do that really shows the bigger picture of how it looks all together. So the next few slides that I will be going over are more product related slides and things that we look for that are offered to Cigna members. Some great products, and these are some of my favorite. Some of the things that are very important to most members. So let's start with the first one, mycigna.com. Nothing is more important than your good health. That's why mycigna.com is your online tool for everything needed within the MyCigna platform. We encourage our members and our employees before they do anything is to download the MyCigna app. Have that app with you, have it accessible for you to be able to make the changes that you need within your MyCigna app. On the MyCigna app, you can find in-network doctors, dentists, medical services. You can view your ID card. You can track your claims. You can manage your home prescription orders or talk with a pharmacist. You can even compare medication prices. We all want to have an idea of how a price would look before we go to the doctor or before we look into our medications. And this is what mycigna.com is for. We have great online programs available, and you have to have those programs and you have to be on mycigna.com to be able to access those great programs that we have. And you can also track your account balances and your deductibles to see where you are in your health journey within the mycigna.com. One of the more important things in MyCigna is the digital ID cards. I know that we've all been to the doctor or been to the dentist and we can't find our cards, but most of us keep up with our phones. So if we do have our cell phone with us, the convenience of having the ID card saved to your wallet, if you have a smartphone, is very convenient. You can download those digital ID cards from your mycigna.com website or your app and use those ID cards when you go to the doctor. You can still physically request an ID card, a physical ID card, if you so choose, but you could also do that from mycigna.com as well. So we encourage employees to register on mycigna.com so they can have that access to their digital ID cards. We also have 24/7 customer assistance. You can reach us 24 hours a day, 7 days a week. We're going to help you get those answers to your benefit and claims questions. We have Spanish-speaking representatives that speak over 200 languages to be able to service any client that may call in, any employee that may call in. We also order an ID card. We update insurance information, check claim status. Those answers are just a phone call away. So we're very accessible and reachable if you have any questions. So we have those 24/7 customer assurance and assistance. Preventative care. Preventative care is defined as routine care that includes screenings, checkups, and patient counseling to prevent illness, disease, and other problems. Wellness is an act of practicing healthy habits each day to attain better physical and mental health outcomes that allow us individuals to survive. We really push preventative care services. Preventative care services is something that is important to everyone, regardless of age. It could be screenings for blood pressure, cholesterol, diabetes, any kind of colon or rectal cancer, clinical breast exams, mammograms, pap tests, immunizations. All those are considered preventative. We push all of our employees to have their preventative screenings, have a relationship with your PCP. We really thrive to have that relationship because if you don't go, you won't know. So preventative care is something that we really push out. The thing that we campaign with a lot of our employees to have those preventative care campaigns to really show which employees are getting their screenings. And if it's a gap, we can help push that out. We can incentivize for them to have that. We can even come on site and do on-site biometric screenings on site for clients and employees to give them that flexibility to be able to allow the time to be able to have those preventative care services completed. So preventative care is something that we stress very strongly, and we want to make sure that all of our employees are healthy and are getting their preventative care screenings in a timely manner. Our suite of virtual services are also very impressive. Whether it's late at night and your doctor or your therapist is not available, you don't have the time or energy to leave the house from a long day at the office, you can access our care from anywhere via video or phone. Get model medical care 24/7. We look at our preventative care. You can have your preventative care wellness screenings at no additional cost. Routine care visits allow employees to establish that relationship. We keep wanting to build that relationship with that primary care physician because those are going to be the ones that helping you take better care of yourself and recommend the different things that you have to do to stay healthy. Urgent care available 24/7, including after hours, care for 80 plus minor medical conditions. And of course, it's less expensive than the ER. We want to really teach our employees to not go to the ER if it's not an emergency. We really want to keep them into the doctor's office. Of course, if it is emergency, go to the emergency room. But if it's not, if it's something that you can wait and go to the doctor with, build that relationship with your PCP. We want to encourage members to save that money by going to the urgent care or their PCP opposed to the ER. Dermatology. This is one of our newer virtual services in the dermatology. the access to our board certified dermatologists. No appointment is required. We have treatment plans if necessary within 24 hours. And of course, these are common conditions for hair, skin, nail conditions. And we also have behavioral care, access to psychiatrists and therapists, video, ability to select the same provider each session, which is a very important note. We want the familiarity with the provider that the member has seen before. When dealing with anything, you want to be with somebody that you trust, as well as someone that you've built a relationship with. So the ability to have the same provider each session helps with making progress with all of those. Virtual and urgent care from ND Live, $121 weighted average savings per visit compared to more costly channels. 11% fewer than expected follow-up visits for same condition than brick and mortar providers, which is great. Some employees just like the flexibility and the privacy of being able to have that call and that talk with their provider in their home setting or in their personal setting. 16% less duplication of care and urgent care visits versus other virtual PCPs and specialists. So just looking at those numbers, these are the things that's offered to you within the Cigna program, the suite of virtual services that we have available as well. Our mental health. In today's world, our mental health needs are as serious as they've ever been. With a quarter of adults suffering from a behavioral issue, what was once regarded as a crisis has become accepted as part of everyday life. When over half of us that suffer don't get care, can we really expect change? When our emotions, thoughts, behaviors become too problematic, it impacts our physical health as well. Over half of those with a mental health condition also has a physical condition as well. Also, the reverse holds true as well, with 1 in 3 with a physical health condition also suffer from a mental health issue. It takes a toll on an individual's vitality. It takes a toll on our productivity, our quality of life, and it also takes a hit with our length of life. And the cost begins to mount 6 times greater. So our goal at Cigna is to get customers connected to the right care sooner rather than later. And with Cigna, these benefits come included. Your behavioral benefits cover more than just therapy. We offer a range of resources to meet you where you are. We have iPrevail, we have Happify. These are 2 apps that help build resilience and manage stress. And the member also gets 3 free EAP visits as well. Also, they will be able to use that same EAP provider. We have Headspace, formerly known as Ginger, is one of our virtual providers that offers coaching, therapy, and medication management as well. So these are just a few of the enriched emotional well-being supports that you have integrated into your health plan. So we really push employees as we campaign to push these resources out to members so they can know that they have access to these great resources, both for our physical health and our mental health. As we go to the next program and product that we have, the Cigna Diabetes Prevention Program, OMADA. This is one of my favorite programs. This is a program that looks to help you reduce the risk of type 2 diabetes and heart disease through building healthy habits, through eating, increasing your activity, and building a healthier lifestyle. You will, with this program, you will receive a personalized toolkit that includes a digital scale that syncs with your app. You would have an app. You will have access to your own health coach, as well as a social support group that has interactive lessons through your app and website. And the thing about the support group, receiving motivation and support from your peers and having someone to help hold you accountable really helps working with a program like this. And this is great for employees that are not a diabetic. This is not a program for someone that is already a diabetic. This is a program for someone that's right there on that line for being a diabetic to really push them in a direction for them not to become a diabetic. So we push this program out. It is not eligible for everyone. You would have to go in my Cigna and take a short questionnaire to see if you would qualify. But this is a great program for employees that are right there on that line that needs a little bit extra support and push to make those decisions about their health in a fun way, in a supportive way. We all want to be supported. Life is hard. Decisions are difficult, especially decisions about our health. Some things can be scary. Some things that employees, they just might not be ready for, but it's always better to go through these things with someone else that it might be impacting as well. Our next product that we'll speak about is the Cigna Healthcare Wellbeing Solution together with Personify. It is our new engaging digital wellbeing platform. This digital experience is integrated within mycigna.com, so it's a one sign-in process. It is personalized, it is holistic, and inclusive to the member experience. So the cool thing about Personify, it evolves as the member evolves. It's AI-based, and the capabilities are included from your medical claims, information that you have provided from the health assessment, and that information is flowing bi-directionally. So the information that you feed into Cigna, it goes into the well-being solutions. Whether it's your health assessment responses, your claims data, your labs, your biometrics, and it goes into the predictive analytics and provides you a more customized customer experience. This program builds with you, and you have access to challenges. It gives you daily content cards, which are information and tips that the program will send you just to make right decisions for that particular day. Nutrition guides, healthy habits, which are bite-sized ways to build on those healthy routines. Those are just, it's great. You can invite up to 10 friends and families for this program to have some challenges and some fun challenges. You can connect your devices with Personify, whether it be an Apple Watch or a Fitbit, to really, flow within the things that you would like to track, whether those be steps or different exercises that the program tracks. You have a media library, and you have journeys. And journeys are different situations that the member go through in steps to really elevate them to be better with a habit that they might have. Example, if you are a smoker, you have tobacco cessation journeys to be able to help you become a non-smoker. So we really want to push this out to all our employees. The Cigna Healthcare Wellbeing Solution, of course, is different packages, but this is a program that I would recommend heavily for all of our customers and clients to be able to build their health and engagement through a personalized experience, something that's growing as you grow, that meets you where you are. So I would recommend that employees look at the Cigna Wellbeing Solutions together with Personify Health. Lastly, we look at identity theft protection. It's our Identity Force for Cigna, offered by Suntech. It offers a range of identity monitoring responses that can help you manage and protect the information that means the most to you. The identity force is included for Cigna members at no additional cost. And it has identity monitoring, which is continuous monitoring of any financial investments or account activity, your change of address, anything that might look off to you. Fraud alerts, you have instant notifications of any credit activity, fraud, compromised credentials, any data breaches. So this is something that as members become active on the Cigna medical plan, they will get an email asking them to enroll into this program. And it just gives you an extra layer of protection that's offered at no cost to you. So this is another great product that we have available, included at no cost, that we also recommend that members take full advantage of when they become active with the Cigna medical plan. And lastly, we look at the Cigna for employers. So the Cigna for employers is really something that the brokers and the clients can look at to see where they are currently within a lot of the things that we've talked about today. One of the more important things that they would look at is the registration rate for the members of who has registered for mycigna.com. Remember, as we talked about earlier in the conversation, we can target different programs, but members have to be enrolled in mycigna.com for them to be able to do that. So we want to make sure that that registration rate is high. And if it's not where we want it to be, we can begin to campaign that to try to get more participation. We can see year over year the increase for that particular registration rate, as well as reporting. Clients can go into this program and pull different reportings, utilization reports for their population. They also have materials, turnkey, easy access, turnkey communications to help really engage different campaigns that we would recommend. And we also have the engagement resources that we're aligned to in this program as well, in engagement resources that employees can look at doing monthly, is opposed to one thing at a time. Because it's a lot of products, and we recommend campaigning different products month by month, building those comfort levels in the information. We don't want to overwhelm anyone with information, but we do want to make sure that we are reaching you with the products that we have available and teaching you how to use those different products. So month by month, we take a different product and we engage the population with that product till they fully understand. And then the next month we focus on something different as well. So the Cigna for Employers is a great resource for the client to go on and really pull that information out for what is needed. So those are all the slides that I have today. I know this was a lot of information, but one thing that I can say, that working with Cigna, we are what we stand for. We serve our community, we serve our clients. We really want to help make things better for all of all that's involved, both clients and members and employees. And we look to do that to the best of our ability all the time. Thank you for having me today. Thank you for the opportunity to present. Looking forward to some great questions and any feedback that you might have as we continue to build our programs and our resources in the future. Thank you, and I will give it back to Rob.
Thank you for that great presentation. We do have some questions. So the first question is Cigna scalable to be able to accommodate a smaller company?
Yes. What number is small? What do you say by smaller company?
I'm going to assume it's less than 20 to 25 full-time employees.
We do have some information for that. We could get the things that we have access to now. Yes, they might not necessarily have a dedicated on-site rep, but we can have someone come out, do open enrollment. We can have someone do screenings and really educate the employees. So yes, we can serve that if we need to. Yes.
Fantastic. Thank you. And thank you for that question. Another question. You talked about early engagement with the employees. Can you share some of the best practices that some of your clients have used
Of course.
for the audience?
Yes, of course. Well, I would say the most uncommon thing, and I know you're going to get sick of hearing me say this, is the mycigna.com process. So some of the early engagement that we recommend is having that demo, having that MyCigna demo to really show the client how to navigate through the MyCigna process. So once the member comes onto the MyCigna medical plan, we look at that, we demo that, we show them how to access our resources. We have that best practice. We look at the registration rate. I say a new client, we maybe look every 3 to 6 months of how that rate has increased. And we begin to campaign based off of that. We always look for the registration campaign, and then we take it into the preventative care screenings. Who has had their screenings for that year? Those are the things that we feel like are the most beneficial for a new client. The registration rate and their preventative care rate. We want to look at that to make sure that clients are getting the screenings that they need. And then we begin to have different seminars about different products that we offer. We look heavily at our behavioral products, and that's something that we also go through at a high level, doing customer engagement to really let employees know, hey, you have this behavioral benefit. So I would say those are the 3 things that I would recommend that any client focus on first. MyCigna registration rate, preventative care campaign, and then we look at our virtual and our behavioral services and get them familiar with those services as well.
Thank you. Another question. This goes to the preventative care campaigns. A lot of companies have those stragglers who, for whatever reason, don't want to get that annual health assessment. What are some of the things some of your clients have done to encourage those employees to go ahead and get that annual health assessment?
Well, it's interesting that you asked that. And usually the thing that gets the most attention is the testimonies of other clients and other employees that has told the story about preventative care saving their life. We also do some incentive-based programs. If an employee gets their preventative exam, they might be entered into a raffle to win an Apple Watch or a Fitbit or a cookbook or any of those type of incentives. But we really want to push that process. Of course, we can't force anyone to do anything, but we give them all the information available. We also have different meetings and seminars to explain to them what preventative care is, why it's important, the process of preventative care. And like I was saying on the call, the biometric screenings. We have the ability to have on-site biometric screenings with clients as well to make that process so much easier. So if I'm coming to your office, Rob, and I'm saying, hey, we have a vendor set up here, come get your numbers, come get a biometric screening. We're making it as convenient as we can for you because we know that every company is different. We have a lot of clients and companies that have different employees that are in the field that just don't have the time or the accessibility to be able to take the annual physical. So we want to bring that to them as much as we can for them to show their numbers. So those are the things that I would recommend with the preventative care. So there'd be testimonies from other employees that have gotten preventative care screenings. Because again, preventative care screenings, those are the things that save your life, is a preventative care. It's going to be things that come up in your life that you're not going to know about if you don't get screened. You're not going to know just by how you feel or how you think you feel. You do not know unless you go get the screenings and go get the blood work and go get have that relationship with your PCP, age-based screenings. because everyone is different. And you also have to have those preventative care checkups because a lot of things are hereditary. It's things that you might not even know that you've had, that your mother or your father or your grandfather has had, that you have to be screened for. So those are my recommendations. It is just vital to have those preventative screenings.
Great, thank you. And Cato, could you tell us a little bit more about the telehealth component and how an employer can use that with their family and dependents?
Of course, it is a great service. So when employees have our telehealth service, it is so simple. They, again, go on mycigna.com. They would go through that virtual care provider, and they would request a virtual visit. And as they request a virtual visit, they will be talking to a doctor, just like we're talking now. And they can prescribe what it is that they need. It's very private and it's very accessible. When we were in COVID, we couldn't go to that brick and mortar building. So virtual care is something that we have really honed into to make it accessible for employees that are going through some things. Even, with me, with having young children, it could, how things can get. It could be 3 o'clock in the morning or anything, and you can call, set up an appointment, and have that virtual care consultative session with your provider. So we really, really push out our virtual care products to all of our clients and members, just to have that accessibility. We never want anyone seeing that they didn't have the access to the doctor. We know that we can't always get into our vehicle and go to a brick and mortar building. And if we do, we don't always want to go to the emergency room. Again, we want to keep employees away from that ER type situation, just of course for savings if it's not an emergency situation. So that's where the virtual care comes in. It's a seamless, easy process. And another thing, going back to the first question that you asked, those are the things that we'll talk about, and we show members within that MyCigna demo process of how to access that, how to look for a virtual care provider, what that looks like, versus not only virtual care providers, but our behavioral care providers as well, how to access those things, because we never want an employee not wanting to go on MyCigna because they feel like the process is too difficult. They don't want to deal with the hassle of going on MyCigna and requesting that. So we want to show them that that's an easy, seamless process to do. Hope that helps.
Perfect. Thank you very much. And on the MyCigna app, that's also available to the spouse and their dependents, correct?
Of course. Yes, it is also available to the spouse and dependent.
Okay. I don't see any other questions in the chat, so I'm going to go ahead and close out today's webinar. Cato, I want to thank you for that great presentation this afternoon. It was great information, and I know our members will utilize these great resources available to them. To our attendees, if you have any other programs that you're interested in, please feel free to shoot me an email and make any suggestions, because as a chamber, we're here working on behalf of our members. So we want to be able to provide as many services that can save you and your company money, keep your employees healthy and productive. Lastly, I want to wrap up with a couple of other programs that we have, and to bring those to your attention. We have a workers' compensation program through Accident Fund that can provide up to a 5% dividend rebate on your premiums. And also we have a great discount program with Office Depot where you can save up to 55% on over 20,000 different office products, furniture, cleaning supplies, printers, hardware, software, etc. Lastly, I want to thank Cato again and my colleague Tunja Lee for doing a great job putting on today's program. And for all of our attendees, thank you very much for joining us this afternoon, and have a great rest of your day.